main role of the doctor is about communication, communicating what the patient needs to do beyond medicine. So all the doctors do advise के ये medicine है, इतने time तक आपको ऐसे खाना है. But now the role of the doctor is expanding. You have to explain to the patient कि beyond medicine आपको ये करना है, ये नहीं करना. One of the most important part is के if you explain diet and lifestyle to 10 patients, I think only 2 of those patients will follow them up properly.
So welcome. Today we have a Dr. Ravi Shah, who is an endocrinologist, to explore the same treatment, how different result will come. Welcome to the Medical Marvel podcast,
Thank you.
doctors.
Thank you very much.
Thank you for joining. So I would love to know, there is a 2 different patients, okay? Same problem, same treatment you are writing. Why different result will come? One will have a results and one will have a lesser or a limited results. What will make the major different for the result?
I think it depends on what is the problem the patient is having. First thing is that for a lot of problems, patient beyond medicines does require to follow a good lifestyle, a good dietary pattern. So how compliant the patient is to the diet and lifestyle, that is also important. And then for a lot of disorders, genetics comes into the picture. So what is the patient's genetics, the genetic background of the patient, that determines how successful the therapy is for that individual.
So you mean to say same treatment for same disease, result can be different based on genetic or patient lifestyle and all?
Definitely. So how good the patient is with the non-pharmacological management determines the success of the pharmacological management as well. And then for the pharmacological management, what is the genetics of the patient determines the success of the pharmacological management.
So what is the role of doctor in this context to get a better result for the patient?
So the main role of the doctor is about communication, communicating what the patient needs to do beyond medicine. So all the doctors do advise के ये medicine है, इतने time तक आपको ऐसे खाना है. But now the role of the doctor is expanding. You have to explain to the patient कि beyond medicine आपको ये करना है, ये नहीं करना है, ये खाना है, ये नहीं खाना है.
So like many doctors challenge have a problem with this. What you said that beyond clinical, you have to do this. They say, I'm the doctor, how do I do follow-up? So how do you keep track and do the follow-up for your patient? So your patient is a long-term patient. They are coming and 3 days they are not getting ready. So sometime you have a 6 months, 1 year, 2 years, more than that during. So if they stop treatment, it's a system failure or it's a doctor responsibility?
I think in terms of follow-up,
patient.
Definitely. So in terms of follow-up, I think what is very important is to have good staff around you, to have a good support system around you. So if the staff is able to call the patient before follow-up, then that makes the job of the doctor and the patient a lot easier. And information technology also comes into the picture. So good software which will have the data as to when the patient should be coming for follow-up. Then based on that software, the staff can then call up the patient, and then the patient will also not have to remember their follow-up dates. And in terms of failure of follow-up, I think definitely more fault lies with the doctor and the support staff, because it is the responsibility of the doctor to educate to the patient that what should be the lifestyle the patient should be following, what should be the dietary pattern, and how frequently the patient has to take medicines and everything.
So how follow-up is making difference for doctor to build their OPD or their profession? How it is playing the major role?
So I think it is very important. So most of my patients, they are patients for the life. Mm-hmm. So when the patient is your patient for the life, it is very common for the patient to have complacency. कि नहीं चलो अभी 3 महीने पहले तो गए थे, अभी नहीं जाएंगे तो चलेगा, 6 महीने 9 महीने चल जाता है. एंड देन व्हाट हैपेंस इज के 1 साल 2 साल कब हो जाता है वो पता नहीं चलता. सो वहां पे इफ यू आर एबल टू रिमाइंड द पेशेंट कि नाउ दीज आर द टेस्ट यू नीड टू डू, now your follow-up is required कि whether you are progressing properly on treatment or not, that makes a huge difference for the patient.
So now my next is the patient today's era, they are coming with a lot of more information. It is a right or wrong, that's a secondary part, but whatever the information they are coming, they are very confident on that. They sometimes they'll doubt the doctor, but they don't doubt their information.
Right.
So how do you deal these kind of patients, expectations for outcome?
I think there spending more time with the patients and their queries is very, very important. So now this is definitely the era of information overload. So anytime there is information overload, your job as a doctor becomes more कि नहीं ये वाली information आपके लिए सही है, ये वाली information गलत है. But just telling the patient कि नहीं ये सही है, ये गलत है, that will not make the patient accept whatever you are saying. So then you need to explain कि नहीं ये वाली सही है इसलिए क्योंकि ये reason है इसका ये सही है,
Purpose behind saying,
purpose
why do you
behind
say?
and what is the mechanism behind it. So explanation and teaching to the patient becomes more important now than just writing the therapy and asking the patient कि ये test आप करवा के आ जाओ.
So, what common mistakes doctors make while managing long-term therapy patients? What are the common mistakes they make while managing the long-term patients?
I think more than mistake, it would be कि the population of India is so huge that any doctor who is successful per patient time will always become less.
Okay.
So there will be some miscommunication which can happen. So that is where your support staff becomes very, very important. Your medical officer, your staff. So where you have less time, when you have less time to give per patient, you need good educators around you who can educate. And if the patient is still not able to understand something, they can bring the patient back to you and then you can re-educate the patient. So that becomes very important.
How do you track or balance or check whether your patient is in a long term it is satisfied or it's not satisfied?
I think again, good support
Because
staff.
it's a manageable therapy.
Right.
In a era where like many disease CKD, endocrinologists, they have to manage the therapy. It's not completely treatment. So
Right.
how do you manage patient trust, motivation during these times? What do you do?
So two things are very important. One is the investigation part. So for all the specialties now, investigations are available which are able to track how the patient is responding to therapy, which are the patients which are non-responders and which are the patients which are high at risk. So there the role of investigation comes into the picture. And second thing is just when the patient comes, you can just ask कि कैसे सब चल रहा है, everything is going okay or not. In most cases, just that one question कि सब सही चल रहा है या नहीं चल रहा है is and then leaving it free for the patient that the patient can respond however they want. In most cases, then the patient asks you कि query कि नहीं मेरा ये वाला part नहीं चल रहा है. So I think two things are very, very important there.
So, like next to same things. In a follow-up, as you earlier mentioned, that follow-up is the most important for the long therapy patients. Like, what one thing you should train your staff to do follow-up?
One thing is that the staff should be knowing the patient follow-up date.
Okay.
So generally, the doctor is writing the follow-up date. The patient is being informed the follow-up date. But you should have some system that your staff is able to track. Ki this should be the follow-up. This is the follow-up. This is our date today, and these are the patients who should be coming for follow-up today. So then the staff can just call up the patients once. कि आपको आना है नहीं आना है. What is the problem you are having? कि आपको 2 दिन बाद आना है तो follow-up date change करके 2 दिन बाद का कर सकता है. So that should be the information.
Doctor who is not using the technology, how difficult for him to do this
I think it is very, very difficult, and now that is why now every doctor should be having a good electronic system where you are able to track when your patient is going to come, how busy your OPD is going to be. So then you can determine कि per patient आपका इतना time रहना चाहिए, and then you can train your support staff around you कि देखो आज मेरे पास per patient 10 minutes है, 15 minutes है, बाकी का 15 मिनट में आपको ये चीज patient को explain करनी है, डाइट एक्सप्लेन करना है, इंसुलिन का इंजेक्शन टेक्निक आपको एक्सप्लेन करना है. फिर कहीं पे पेशेंट समझ नहीं पाते तो उनको वापस मेरे पास लेके आओ. तो देन आई कैन देन टीच द पेशेंट दोज हु रिक्वायर दैट separate individual touch. उनको फिर you can then tackle those patients as well.
So good. Last, my question is one truth which is about the patient behavior. Doctor know, but they don't talk openly. The patient hidden things.
I think one of the most important part is that if you explain diet and lifestyle to 10 patients, I think only 2 of those patients will follow them up properly. Okay. And there are a lot of reasons, there are a lot of environmental reasons, because it is not just the patient. पूरी फैमिली को डाइट एंड लाइफस्टाइल फॉलो करना है, तो उनके आजू बाजू में सपोर्ट सिस्टम पेशेंट का खुद का कैसा है, दैट डिटरमाइंस हाउ सक्सेसफुल डाइट एंड लाइफस्टाइल विल बी फॉर द पेशेंट. So generally, what I generally see in my OPD is the patient who is coming with 2 or 3 relatives who are there with the patient day in and day out. That patient's diet and lifestyle will be a lot more successful than that patient who is just coming alone to your follow-up OPD.
So it is a not like no measurables that how he is doing diet, what he is taking. So like an endocrinologist like you, what system will follow that you make sure the patient is following, like majority of time, all the patient you cannot control, but the majority of patient following, so you can get a better outcome in terms of results or a disease.
Most important is tracking through technology. So if we look at dietary pattern, what you can do is you can teach the patient or their relative to track their calories.
Okay.
So now all chat GPT and all the artificial intelligence software, they're all very good that they can help you manage and track the patient. Then the patient can come to you for follow up after 7 days, after 15 days, after 1 month, and then you can just see that what was the patient's calorie tracking which was there. Second thing is you can teach one member of the family. That is the most important. कि rather than the patient, you teach the patient's son or the daughter कि आपके father और mother को ये चीज करनी है. And if there is accountability from someone in the family, then the patient is a lot more likely to follow up. And then in each and every follow up, check whether the patient is following the therapy or not. So just not कि उनके report सही है या नहीं, मेडिसिन सही चल रही है या नहीं, साथ साथ में वो डाइट है, लाइफस्टाइल है, उसको भी प्रॉपर्ली फॉलो कर रहे हैं, तो उसका एक 30 सेकंड उस पर अगर आप स्पेंड करते हो तो देन दैट इम्प्रूव्स योर सक्सेस रेशियो लॉट.
So my last is, if any doctor is starting right now, what online marketing to activity or offline to activity he must do to build patient base?
In terms of marketing, I think two things are very important. One, you need to educate to the patient. So for education, all the social media platforms like Instagram, like Facebook, they are very, very important. And then you need visibility. For visibility at your local area, Google and Google My Business Profile comes into the picture. So I think those two are very, very important.
Offline?
Offline, I think offline again, whatever networking, as much networking as you can do, that is less. So networking with other doctors and networking with other patients, that is very, very important.
What is one last advice to doctor who is not using social media for education purpose?
I think for new age doctors now, social media is a necessity.
Yes.
Because how are you going to differentiate yourself from other doctors which are also there 500 meters, 1 kilometer away from your practice? In the previous area, what used to happen was that the patient would come, they would see your board and then they would come to your
Agree.
clinic. Now that is not there. Before the patient leaves their home, they have already decided कि नहीं मुझे यही डॉक्टर को दिखाने जाना है and यहाँ पे ही मुझे दिखाने जाना है. So there social media face value comes into the picture. If the patient know your face, they are more likely to come to you, and then your visibility on social media platforms also comes into the picture.
So thank you very much for joining this podcast and sharing your wisdom and knowledge to doctor community who's handling long-term patient or long therapy patients.
Thank you very much for
Thank
inviting
you.
me. Thank you very much. Thank you.